And we're back for the firing line. Your questions, the only hour of the week where we don't take callers on live, but we do have live here in the studio the host with the most, Michelle, who's going to give your questions to me. Hopefully I'm in the batter cage and I'll hit them correctly. Otherwise, it might be quite funny. And hopefully you'll be informed and healthier and informed in other ways, perhaps. But maybe a little bit of humor, too.
The word of the day must be hopefully.
Hopeful.
2 or 3 hopefully.
That's good. Well, let's hopefully we can get through all these questions today. So, yes. Michelle, you have announcements.
We rarely get through them all, but we get as many as we can. And hello, everybody, on this September the 5th. Here we are, getting into fall, my favorite time of the year. Summer's too hot, but fall's perfect. So is the spring.
I like summer because the pool is open.
I know, you're the pool guy. Gosh, Bill's in there every day. Every day. Pretty much.
That's
except
good,
if I drag you someplace.
That's right. I think I'm a water beast.
Yeah, you and Kels. Anyways, I'd like to talk about the sale, and I'd like to thank everyone for another big, huge, successful sale. And big savings for everyone out there. Obviously, you take advantage of them. We're back to normal again now around here. And Mitzi wanted me to tell everybody that all of the packages got sent out. We were overstocked. This time we're getting a little better. Hey, Bill?
We have improved dramatically. And, of course, all of our suppliers that make our stuff for us are doing fantastic jobs. So we want to thank them as well. And we want people to have I call healthy sailing toward a holiday season coming this year where you'll be smarter, slimmer, and younger than you were last year.
Sailing? You're talking about the cruise?
Yes. That's why I'm kind of alluding to that.
Don't forget the cruise is coming up November 22nd to the 29th over Thanksgiving. We will not be here. We will be having fun on the sea and learning on the sea.
Learning on the sea. It'll be fun. Yeah.
Phil, I talked to Blaine again.
Oh, yes.
Up in Alberta. I know Blaine is a friend, Canadian, and he's Edmonton is where he's from, but he always has good questions because he takes almost as many supplements as Bill, I think. He's the only person that can down 100 at a time, sort of thing. And his question is about absorption. What capsules, like the ones like Nutrimedical, is a tablet, right?
Yeah, it's a time-release tablet.
Cell Defense?
Cell Defense is a tablet. They're all specially time-release. They're not like we call latrine bullets, like the one vitamins that are sold by the big pharmacies or whatever. Mm-hmm. They'll basically come out in the latrine. These dissolve as soon as they hit your stomach, and they slowly release through your small bowel.
If a person has a problem with absorption, is it the digestives that will help with their absorption? What of our products helps with absorption? In other words, if you want to get the most out of your supplements, you want to make sure they're getting.
We want normal bowel transit. If you have rapid transit, you've got colitis or very bad irritable bowel syndrome.
Yeah.
And so if you want to correct that, we use 3 things: IBS care, which is the propionyl carnitine to normalize peristalsis; gastrozyme to digest your food, so you're going to have more normal digestion peristalsis; and I would recommend probably something like the ageless powder. You can also, if you're hypochlorhydric, which would show up in a QRMA test, or if a gastroenterologist looks down there and says, you have a specific appearance of the stomach wall lining, you would benefit from the digestives. So the 3 I would recommend would be ageless, gastrozyme, and IBS care.
I have a question, and that is when you eat an orange, for example, like say you just sit and you eat an orange and you get the pulp, you probably get some fiber right out of the pulp and whatever. What's the difference in absorption when you eat an orange and when you take a couple Power Cs?
Oh.
For the vitamin C, how does it work?
Well, the vitamin C content, it has bioflavonoids, which are helpful, but the thing is, what you want high absorption of the ascorbic acid. And you also want it to not be acid, because you only can take so many milligrams. An average orange is, like maybe 80 milligrams of vitamin C. And the peppers are up there too. But when you take a Power C, you're getting 1.5 grams, and you're getting as a neutral pH, calcium, magnesium, sodium, potassium ascorbate, with a special black pepper extract called bioperin.
And what does that do?
It means you get 40% more absorption because of the bioperin.
Yeah.
So there's no comparison even to the liposomal. The liposomal is teeny-weeny dosages, so although it's better absorbed than regular vitamin C, you're not going to get in the gram dosages. If you want to stop a cytokine storm, if you want to get your body into an alkaline state, you want to be using the Power C+.
Next is Eric. Now, I'm a little late on this one. He asked me this about 3 weeks ago. First of all, he wanted a product sheet for the Gamma E. And Eric's from Vallejo, I think that's how you say it, here in California, Southern California.
Vallejo.
Not Vallejo.
Vallejo. Yo. I think sometimes Jay is...
V-A-J-J.
Yeah, Jay is interesting in Hispanic.
Vallejo. And anyways, we're talking about the Gamma E, Bill. What is the is that a vitamin E? There's
8 different tocopherols, and then there's trophotrienols in it. It has the alpha delta, the alpha tocopherol, the gamma tocopherol, etc. All the tocopherols. And the thing is, the most important one to stop vascular disease and brain damage is the gamma tocopherol that stops peroxynitrate. If you take D-alpha, which can be synthesized, it can actually lower your
You're
gamma.
Getting complicated for me. I lost you way back.
You got to have all of the complete different subclasses of the tocopherols.
So what does Gamma E? What does vitamin E do? Why was a person
vitamin E? Vitamin E basically does several things. The first thing it does is it protects your ion channels for calcium. Uh-huh. So and it also induces natriuretic peptides to your heart. So if someone is getting heart failure, one of the first tests we do is this thing called a beta natriuretic peptide. Mm-hmm. If it's high, it means you're compensating. You're trying to stimulate your heart to overcome something toxic that's affecting the heart, like heavy metals, bisphenol A, toxic chemicals, or something like drug you're taking, like coenzyme Q10 or a beta blocker, which blocks CoQ10 metabolism. So your heart's going to counteract it. So the vitamin E, in fact, if you actually look at and I've got literature I've talked about here on the show, if you measure survival rates of people with heart disease, whether it's congestive heart failure or heart hypertension or coronary vascular, the vitamin E level of the gamma tocopherol is a better predictor of survival than cholesterol or C-reactive protein. It's a better predictor.
Is it a blood thinner? What does it do that it helps the heart? What's it do?
It helps protect your ion channels in your calcium ion channels in your heart muscle. It helps protect your ion channels.
It's nothing to do with thinning blood like nattokinase.
It can thin it a little bit, but it's not a major factor. It's a minor factor.
Nattokinase does that. Is that right?
Nattokinase is from the Bacillus subtilis. It's an enzyme that's made on a natto bean. And Dr. Holsworth... Subtilis. And it's made in natto bean, developed by Dr. Sumi in Japan and Dr. Holsworth here in America.
I got a question for you. You've been talking to me like this for 30 years. We've been married.
Yeah.
Bacillus? What is
Subtilis.
It? Yeah. Now, do you really think that I know what you're talking about? Just answer. Do you think I know what you're talking about?
No, you might be able to regurgitate it, though.
I need, little words.
Yeah. That's as
I
little,
that's
as, little as it goes,
right.
actually. That's the actual word, though.
Oh, gosh. But anyway, so next is Sam from Hawaii, and this question came through Mitzi. What to take for heartburn?
GastroHeal. Chew 1 to 2 every 4 hours.
What is heartburn?
Heartburn basically is usually acid reflux, and you may even have some abnormal peristalsis, so that it'll go above the crust of the diaphragm. The actual esophagus will crawl above the diaphragm and you form a sac. We call it a hernial sac. And that can be dangerous. You can actually rupture it, you can get infected. And if it's inflamed for a long time, you can get a Barrett's esophagus that can turn to cancer. So you can get esophageal cancer. Usually at
regular old heartburn, just GastroHeal.
Yeah, GastroHeal. Yep, does the trick. Plus, also you want to kill off the pathogens, so I would recommend Allison Med Silver 100 spray to kill off, because often there's bacteria growing down there and fungi, and you want to kill off both.
Take Alimax.
Berberstatin's good too. Yeah.
Every day.
Yeah, every day. Because it's usually there's often we call it an opportunistic bacteria and fungus that grows there too.
Brenda. Hi, Brenda, up there from Alberta, Lethbridge, to be exact, Canada. She wanted to know if you would be able to tell her the top 10 of our products. So I think we'll do that when we come back, and we'll think about that. Top 10 selling, she wanted to know, of our products.
Top 10 selling or top 10 that I would recommend? Which one? Which list do you want?
I don't know. She said selling. I don't know. I guess she thinks everybody else is buying it. It's going to be good.
How about the top 10 I'd recommend? That'd be better.
Top 10 that you'd recommend? We'll go for it on the break, Brenda.
Yeah, sounds good.
Come on.
Oh, yeah, come on. I can hear Michelle laughing, so she's collaborating here on my list. Selecting and chopping. So
I'm telling him what to say. Imagine that.
Well, partly.
Okay, Bill.
Okay,
10.
let's go through the list. First,
10 top selling and the choices.
Yeah, I would say I could always go 20, but I'm going to go 10. Okay,
you could always go 100.
Always go 20. Yeah, no. Let's start off with Nutridyne, number 1.
That is
the number 1.
Definitely always. That's our oldest product.
It's probably one of the most important products because it's the only one that's the diatomic Tesla activated iodine. No one else has anything like it, and if they say they do, they're liars. Silver 100, the only ionic silver in the world. Anybody else who says they have an ionic silver that kills pathogens or stimulates stem cells, they're also liars. Alamax and Alamed we have had for years. They've been their scripts in Australia, New Zealand, Great Britain, and Europe. Our Allicin Med, which I developed, is now 200 milligrams more than the Alamax, the Alamed, and it's cheaper. So it's to say you give the high-powered Allicin, but you get even more at a better price. Vitamineral Max, which is, remember, all other vitamins from any other company do not have the activated form. Ours, throughout all of our nutraceuticals, are the final activated form, so it jumps gene defects or SNPs and toxic blockade for enzymes. Next is...
And by the way, our Vitamineral Max is on sale. It's a special, an ongoing special, nothing to do with the 7 for Heaven. And it's just $32 and free shipping. And that's for 120 capsules, a double bottle.
And of course, it's Twin is Minerals Plus, which includes the other minerals that we want to increase.
That's not in this list.
No.
To the list.
Cognition Plus. Yep. Cognition Plus for your brain, for brain protection, brain power, memory.
Yep.
Bone Generator for bones, which is bone crystals. It has the trace elements silica, boron, manganese. Cardovite for heart protection, tonic for life, detox, etc. Collagen Max, amazing stuff. It not only makes you look better, it makes your bones not wrinkle inside your bones and connective tissue. So if you get a partial tear of a meniscus,
works on the in and the out.
In and the out, yeah. Power C Plus, the only neutral pH vitamin C in the world. And then you get super high dosages.
And NutriDefense, the last one.
NutriDefense is the last one, and NutriDefense I designed.
That's your top 10 selling and
supplements
whatever.
And then, of course, I would say all the drinks I would include as a separate category. Ageless, Life Support, Glycemix, NutriComplete, which, by the way, is finishing lab testing now.
My goodness.
So, it is actually in the facility. Lab testing's completed. It's shipped. So we'll have it in a couple of days. And of course, Calm Mind, of course, is one of our drinks. I think
that's very popular.
It's better than booze. It's better than anything else.
Better than booze?
Better than it.
I've never tried it.
It's that good.
My
and it lasts longer. And
fine.
don't get a hangover. You're calm. It's you have a Zen moment when you take Calm Mind. Plus, it doesn't make you stupid. It makes you relax. And
does wine make you stupid?
If you have enough. If you have a little bit, you're okay.
Yeah.
It helps it. That's why they call it the French paradox, where they have much lower heart disease and stroke and other problems.
It's beautiful with the meals.
red wine, yeah. Resveratrol, which, by the way, lengthens your telomeres, etc. But we have our...
Oh, you didn't mention Anti-Age Max.
No, I didn't put it on the list. I would start my 20 list.
Yeah, I know.
The triad is Nutritrel, Anti-Age Max, Supernox.
Yeah, I know. That was a difficult question, well, Brenda. But Brenda, I hope that helped you a little bit.
Yeah.
and we'll have to stop it there. Let's get into the emails, Bill.
Right.
We'll start with Paul from right here in Vista, California.
Uh-huh.
He said he's 35 and not overweight, and I have extremity weakness, particularly at the end of the workday, which is strange for me because I'm young. Could it be a CoQ10 deficiency? I also feel my reflexes have slowed slightly over the last few years, and is that normal aging or what? He doesn't know. I have worsened left knee pain. I have clicking and grinding sound, particularly every step I take. The only prognosis I received so far from the bone doctor was that my kneecap isn't tracking correctly and that I need to wear a knee brace, which he felt would solve the problem. How do you feel about this? Could this be the case, and what would you recommend?
Well, the first thing, we can start from his foot backward. We'll go backwards, okay? And let me see your notes there, because he's asking a zillion things. The first thing is you don't just put a knee brace on. The forces vectors start from the foot. So what you do is you want to get a custom orthotic done, and it'll deal with tracking of the kneecap. Then you want to have custom exercises done with a professional trainer or go to a fitness clinic, and they'll determine what muscle groups you need to exercise to improve tracking. Then you can put a knee brace on if you need to reduce the abnormal tracking of the patella. if there's any grinding occurring there and any fragments behind the patella, they have to clean it out, or those fragments will calcify and eventually chew up the cartilage and the condyles of the femur, and eventually you can get osteoarthritic degeneration.
He says he's noticing a small lump of swelling behind the knee.
Yeah, well, that could be synovitis there. So you get a posterior compartment synovitis, and you'll be getting a synovial cyst there. So that's something, and they can determine that if they do an ultrasound. Regarding the other things, chronic fatigue, there's no such thing as normal aging. Aging isn't normal. We assume it's normal because it's common. People age. Everybody ages, but it's not normal. And the reason is you have the same genetics when you die as when you're born. And in fact, if you take the stem cells, you'll find even 2 to 5% of stem cells in 82-year-olds at the moment of their death are identical to when they're a newborn.
Okay.
So when people their energy levels are low, first off, we try to increase CoQ10 Supreme. I usually recommend at least 1-3 times a day.
1 second. Right here he says, I even have fear that I may have early signs of Parkinson's, because he said of the numbness that he's getting in his extremities.
If you're getting numbness in your extremities, the first thing to think of is that you're getting polyneuropathy. So I start off with Nutritrala, Neurogen, Nutrifos, and Omega Supreme Krill, and of course protection with a Cognition Plus and Brain Power, which will protect against oxidative stress. And you want to increase nitric oxide, you want Cardivite and Supernox. In terms of energetics, IBS Care, which is propionyl carnitine, and CoQ10 Supreme. Those are the first two. You can add to that mitochondrial catalyst, mitocarnitine, and uridine monophosphate, and it'll increase the production of energy, ATP and NADH. Basically, if someone is still fatigued, the next thing I step up is Semethyl, acetyldenosine methionine, 1 sachet in the morning and night, and BioLVR. And if they still have fatigue, then I'll add Narival, which is acetyltyrosine with a little bioperin, and we step it up to do the pteridine 4 BH4 bioperin. But most of the time you're dealing with somebody that if you just give them some IBS Care and some CoQ10, their energy level will rise, and add the Cognition
And will
Plus.
that help with numbness?
The numbness will be helped if he's getting peripheral neuropathy, and of course if it persists you have to make sure he's not pre-diabetic, or he's got a toxic problem. For example, some people, for example, if they take a non-activated form of B6, like the regular vitamins, they'll get a B6 neuropathy if they get over 100 milligrams a day, which is really easy with the typical garbage vitamins out there, which are all of them.
He said he wasn't overweight, but I guess he could have the other type of diabetes. Does that present with numbness?
And you can get neuropathy beforehand, but the most common thing when you get...
Do both types of diabetes have numbness, or just the number 2?
Both types, but the most important thing is that if he's not diabetic, is toxic neuropathy, either due to a nutritional imbalance, like if you use L-thiamine, it'll help reverse it. Very important, which is our ultrathymine B1 or the L-thiamine. And so there are protocols for neuropathy and Nutritrala, etc. And as I say, aging is not normal, fatigue is not normal. It's a matter of just fixing the chemistry, and the body will respond. You don't use drugs, you use nutraceuticals to fix it and jump to gene defects or toxins.
When we come back, we'll hear from Joanna from Pennsylvania.
Does that make sense? I hope it wasn't too long-winded. And we're back with Michelle, and she's got your questions, so hopefully I won't be long-winded. That was a rambling, very complex email, and of course he asked a lot of questions. We try to give him the quickest, I call zippy answers, but it's it's complex and may require, I call them multi-levels. So let's move on.
Okay.
I'll try to be quick and give you 1, 2, 3. How's that?
Let's go. Joanna. Hi, Joanna. And she says, Sharif, one of my tenants, has bumps appearing all over his legs. The doctors don't know what it is. He thinks something may have bit him at work. He's a caretaker for a group home of mentally handicapped. Please help. Lots of love, Joanna. Just spoke with him, and they're itchy, and he wants to pop them and remove the skin. And the doctor removed one to get a sample to test and said the fluid is clear and looks fluidy, not pussy.
The first thing you want to think of is, does he have bites like mites? Mm-hmm. And mites or bed bugs can bite you and cause all kinds of rash. They're really blowing up. It's funny. Right as we're having economic problems like before the 1929 crash, there was a big explosion of bed bugs, and it's happening again. Oh. Kind of interesting. It was a bed bug 29 crash like they talk about it. And the second thing is that he could have a topical intolerance of something in his washing his clothes, or they bounce, or they fabric softener, which is very commonly a toxic contact.
It wouldn't be like scabies or anything like that.
It can. Well, scabies will have a specific pattern.
Pussy?
Usually, you'll find it along the hairline. Usually, you'll get secondary bacterial infections if you're. And then the next thing to think of is, does he have? Does he have what we call whiteheads? You can have whiteheads, but usually they're in specific areas. They don't come, and they're not itching all over your body.
So it's just his legs.
Yeah, the most likely thing that he has is he has some form of contactant and/or bites, like mites or something like that. And I would put curcumin cream on there and Magna Smooth to stop the bites, and I'd spray it with Polysilver 100 or apply Nutridyne.
Bill, the next one looks like a doctor, JB, who says, he's talking about this enterovirus case?
Yes.
Can this new disease be misdiagnosed as viral pneumonia?
I remember seeing that email actually just before the show today. Yeah.
We saw 4 cases recently and may be battling another one ourselves. The symptoms are fever, slight cough, what's that? After 3 days? What's that?
Subsidence. Yeah, in other words, it goes away, settles down.
And relapse. Yeah, you read this one already.
Yeah, I remember seeing that. Basically,
you need
a little more. Yeah, it's a little more complicated. You need a little research first. You want to find out what viral titer it is, and there are antiviral antibody labs that can tell you which virus is likely. The next thing is the most likely thing is he has a viral. Most likely, it's a viral laryngotracheitis and pneumonitis, which is causing the cough.
The big thing is the coughing.
Right, it's called laryngotracheitis, which is inflammation of the larynx and trachea. Go ahead. You had another question?
I was trying to say, Bill, it's important right here what he says at the end. He's giving Silver 100 in aerosol.
Yeah, but I don't know what dosages they're using. See, if you're going to use Silver 100, you can...
That's what he wants to know from you.
What I would do is recommend 3 drops in an aerosolizer, either a Sinupulse Elite or a Omron, which is a typical medical aerosolizer, and you want to use inhalations 3 to 4 times a day. Mm-hmm. I would use also anti-inflammatories like Cell Defense, Power C Plus to stop the cytokine storm.
Yeah.
And I would also stop Nutritrala and Cell Detox Glutathione, because in fact, as you raise glutathione levels, you reduce lung inflammation. It's very important for the lungs. So Nutritrala and Cell Detox Glutathione. And the Cell Defense is very good for reducing lung inflammation of lung tissue.
He says 3 weeks ago, it was in Wichita, I guess, Ohio, Kansas. He's showing you all kinds of cases. I'll just give this.
Yeah, it's spreading. We have all kinds of, by the way, some of these viruses have come up in Central and South America with our illegals that have come in because they're bringing viruses that are not typical in the area, and they're coming in. But the population's getting weaker because of toxic food and now the Fukushima radiation, which we report on every week. I use on Thursdays with Chris Harrison on the second hour of Rents when I do a report like last night.
Next is David from Santa Rosa Valley, north of Thousand Oaks, California. I would like to thank you and Michelle for all you do and for the great sale last weekend. It was a great savings. Yes, it was great savings for many people, wasn't it, Bill?
Don't think that's going to stay there.
Okay. My question is, what do I do for my pregnant 33-year-old, 120-pound daughter-in-law who is due in February who has frequent headaches? Most of the vitamins for headaches say ask your doctor if pregnant. Her doctor says all she needs is her prescribed prenatal vitamins and take Tylenol for her headaches. What would you do since at this time you are kind of like in my shoes since your daughter-in-law is due in April? That's right, David. Go ahead, Bill.
Well, one of the things I tell people is you should never use Tylenol, ever. Know whether you're pregnant or not, and even for guys who never can get pregnant, don't take Tylenol, ever. Especially during pregnancy. It's toxic. Toxic to kidneys, toxic to fetal development, it's toxic to your liver, it's bad. Okay. In fact, if you look at the renal units of the people that go into renal failure, number 1 is diabetics, number 2 are people that take Tylenol.
Yikes.
People that go into liver failure and kidney failure.
Okay.
Secondly, the things you have to know the ontogeny of your headaches. Are headaches due to a mechanical problem like a subluxed vertebrae or interfascial entrapment, which can be dealt with by deep massage and acupuncture, which is easy. If it's a migrainous headache, which I assume it is, or it's a combination trigger headache, which could be TMJ, I would use very safe things like Cell Defense. I wouldn't use enzymes like nattokinase, but I use Cell Defense. I would use topical things like curcumin cream on the areas. Can
you take Inflamex when you're pregnant?
I wouldn't, because you don't want to reduce... Inflamex might reduce might have some effects on bleeding or on the attachment of the placenta. So I wouldn't take Inflamix.
Okay.
But I would take Cell Defense. I would also take things to reduce migraine headaches like BioLVR, Samethyl, which is acetaminophen methionine, Power Methyl B12 and Superfolate, and coenzyme Q10, which is extremely important to stop migraines. And you can take one every 4 to 6 hours, and if necessary, bite it and hold it under the tongue.
And that's good for the baby, right?
Good for the baby, and also you want to take fatty acids that'll help stabilize it, like Omega Supreme Krill. Those are all safe. And Lumen Photon, very good for any kind of medic. TMJ, musculoskeletal, occipital neuritis, sinus type, trigger headache, or typical migraine, which are nucleus trigeminalis. You put the lumen pad at the base of the skull to the top of T1, and the nucleus is called the long thin nucleus in the anteroventromedial spinal cord, and it'll stop it. You want to put it on the setting 7, and it'll turn off the migraine within 5-10 minutes. Along with the most important, if you're traveling anywhere, is carry your Samethyl, B12, and CoQ10, and that'll stop it.
Next is Joel from East Sussex in England, and he says he's got a few questions here. One of them is how to take the Silver 100 and how much to take. Remember, he had dental problems.
Well, if you have an acute infection, it's per 10 pounds body weight. 3 drops or 1 spray per 10 pounds body weight under the tongue. If you have a respiratory problem, you want to inhale at least half the dosage and rest under the tongue to go directly in your bloodstream. And if you're trying to do inhalation therapy, like we mentioned that earlier case with Dr. JB, then you want to use an Omron or a Sinupulse Elite to get really deep inhalation past the respiratory bronchioles.
Bill, he's also purchased Indiamese, and he says, I'm using at the moment 5 drops in the morning with an empty stomach. Should I take more?
No, 5 drops is plenty.
Okay.
And 5 drops usually at bedtime. And you want to have no food, water, or any other supplements for 20 minutes.
And briefly here, we did hear from our doctor friend in Malaysia, Wu Yi, and he had a question again. He says that, hello from Malaysia, thank you for the 7 on Heaven sales. I have already gotten the Lumen Photon, and me and my dad started to use it religiously. The shipment of the Somnipulse, he also got the Somnipulse, he's looking for that. His question is, can you recommend a company selling the hyperbaric chambers in Taiwan or Malaysia? Yeah, in Malaysia.
No, there's only one manufacturer that manufactures these kinds of chambers, and it's here in America. And the reason is, all the other chambers we call hard-sided, or they're really heavy and thick, dark, hot, and noisy. This one is the most they're going to
be easy to ship.
These are also easier to ship because they're very light.
Yeah,
they're very light walls, very thin, extremely powerful, bright, and it has a special technology to keep them cool and low noise. So they're really easy to ship. You can contact them. They ship everywhere in the world, and because they're light, they're easier to ship. They're much less heavy than the other machines.
So they'll ship everywhere?
Yeah, anywhere. Welcome back, and Michelle, let's see if we can get through the rest of these in the last segment here.
Yeah, it's okay. Take your time. Okay. Clyde from Georgia. I am not a vegan, but I have almost given up eating meat because of the toxins. I like to eat beans and rice, but I know that there are toxins involved there as well. What is the best way to detoxify when I consume these?
Well, toxins are everywhere, but there's a low level. For example, if you eat veggies, you're going to get some heavy metals like lead. And things are naturally present in the soil, and as the soil gets more acid from acid rain, it increases the level of heavy metal absorption. So I started off with Kelar Max, 2 to 4 capsules twice a day, and Ultra Liquid Zeolite, 13 drops in water 3 times a day, filtered water.
And if you take the drinks, did we talk about the drinks in the top 10 products?
Yeah, the Ageless Life Support and Glycemics, they're going to detoxify you because the Life Support is basically a detox drink. The Ageless actually is life extension and immunological support, and the Glycemics is blood sugar stabilization, mood stabilization, and reversal of the metabolic stress that strains your adrenal glands, your pancreas for your insulin and diabetes.
Listen to what he goes on to say here, Bill. The U.S. Preventative Services Task Force, the agency that advises the U.S. government on preventative medical measures, has advised that people without symptoms of vitamin D deficiency do not need vitamin D testing, and that 800 international units is as large a dose as you can take, and it'll cause kidney failure.
Let's X that. First off, you can do a LabCorp and Quest and measure your blood level. Yeah. Everyone should achieve this high level as possible, up to 100 or so units, which is, you're not going to take too much of it. The idea you're going to get toxic is stupid. And a lot of people that have a tan, they think, well, I'm out in the sun all day long, whatever, or they're getting their arms and face exposed. They may not have normal levels unless you test. So you can't assume that. So I tell people, when people make those kind of statements, they're unqualified, they're idiots, and they don't recommend testing because it would embarrass them to show that the people have low vitamin D, for example. Vitamin D level is a major risk factor for heart disease. If your D level is low, your stem cells don't work, so you can't regenerate your blood vessels or your heart muscle. Mm-hmm. So, and stem cells in your body to rebuild your bones and everything else, without vitamin D, stem cells don't work. So it's stupid. It's like another example of the big pharma trying to go through regulatory agencies to diss nutraceuticals, when in fact every day, as I say on the show, to build a better you. That would be the tagline for Nutrimedical, because every day you're rebuilding yourself. You're not the same person you were 10 years ago. You have actually completely rebuilt yourself.
Next is Art in an email. Hi, Doc. During the night, sometimes rarely, after I urinate, I do experience a mild discomfort in the lower abdomen. Is it prostate? I get a sensation that I have to urinate again, and then it goes away after about 10 minutes.
Bladder spasm. And the first thing you want to do is take Prostate Flow, 1 to 2 soft gels twice a day. I would just stop bladder spasm and use Bladder Up, 1 to 2 soft gels morning and night, and Swedish flower pollen, 1 to 2 tablets 4 times a day, every 4 hours. And that'll stop the bladder spasm. If there's low-grade infection, I'd start off with Alamax, Alamed, Alsamed, and Silver 100, knocking out the infection, because it could be a ureaplasm or a bacteria like E. coli in the bladder, which can happen, or a mild prostatism, which could be infective, and that'll knock it out. Like you can even get Giardia lamblia and other types of pathogens, or Trichomonas vaginalis that can actually get in the prostate gland.
Okay.
Yeah.
Wesley, in an email, I have been experiencing a bitter taste in my mouth for quite some time. I have been exposed to all sorts of chemicals, working in pulp mills and various other industrial sites.
Right.
I was an iron worker and welder, and I became a vegetarian about 20 years ago. I'm 64 years of age. I would be interested to know what's causing the bitter taste in my mouth.
Well, the most common thing is zinc deficiency. If your zinc and copper are imbalanced, then you're going to have that happen. Secondly, if you get toxins, you want to detoxify. Start off with xenoestrogen detox and NutriDefense for the chemicals, heavy metals, Keeler Max and the ultrazeolite, and then infrared sauna, like the Proline infrared sauna, and you can start off with the Lumen Photon. And they'll basically make your body stimulate detoxification. By the way, when you put the Lumen over one area of the bottom, like the abdomen or a T1, the L1 area of your lumbar spine, every 7 seconds, your body circulates all your circulation. So even though it's only over one area of the body, it's detoxifying your blood everywhere, because it flows underneath the lights. Because your body's going to, every 7 seconds, on average, it'll be more or less a few seconds, because your heart rate will actually pump all your blood to your body through every 7 seconds.
Before I go here today, I've got to read this email. It is from Dave and Jean over in Alpine, because I know they listen all the time. They're our friends. Right? Anyways, hi, Michelle. Hope and pray that all's well with you and Bill and the family. Jean's out of menopause now. Jean, everybody knows, which is awesome, because she's using her gifts of miracles, humor, and spending. That's cute. You know what? You go, girl, Jean. And I can't wait, because guess what? They're coming on the cruise with us, and
I got a joke about menopause.
Okay, go for it. Jean will love it.
At a certain age, men need to pause when they make statements, or they have to walk lightly by their wife on certain days. It's called menopause. They have to pause.
You know what you say.
In other words, if they have any smarts about them, that's all.
Okay, Bill. Oh, look, this is funny. You just mentioned zinc. This is Kevin's question. I've been looking on your site for zinc. I can't find it.
The higher concentration, it's in Vitamin Mineral Max, and also a higher concentration in Minerals Plus.
Okay.
And it's an attracts amino acid chelate, which is going to jump the regular transport mechanism, so it doesn't compete with other minerals, and you get much higher, but you have to have balanced absorption of the zinc and copper. You don't want to get out of balance. Very bad to be out of balance.
Next is Carlos. Please recommend what medicine.
By the way, you can also get it in zinc in the GastroHeal, because it's zinc carnosine. Okay, go ahead.
What recommended medicine to take for hepatitis C virus?
We can take all that we call triple threat, which is Nutriodine, up to 20 drops 3 times a day, Silver 100, 3 drops per 10 pounds body weight, or 1 spray 3 times a day onto the tongue, Allicin Med, I'd recommend 2 capsules 3 times a day. And immunoglobulins, Immunimax, or 1 teaspoon, or 3 capsules of Nutrimune, or the Ageless. And I would take high-dose Power C. I'd prevent scarring in the liver using enzymes Inflamax, because intrahepatic scarring causes sinusoidal blockage of the liver sinusoids. You can get backup circulation and increase what's called splanchnic hypertension and esophageal varices. You want to stop that. And I'd use Inflamax, 4 to 5 capsules twice a day, and possibly lumbrokinase, 2 capsules twice a day. And you can monitor it by monitoring the ultrasound of the liver and the esophagus to make sure you're not developing varices.
Next is Charles from New York. Please recommend the best supplements to help repair and build muscle. My son is lifting weights for strength training for basketball. Trainers are pushing powdered whey from GNC, but we know better than to trust that stuff. What should we put in our son's body to build muscle, and what to stay away from?
First off, if you're trying to increase growth hormone output, you want to use Supernox, 2 caplets 3 times a day. Microdose, which is actual homeopathic growth hormone, it's 100 nanograms per spray. So you want 5 sprays before exercise, morning and bedtime. You want to be taking Collagen Max that increases connective tissue strength, because the muscles build up quickly, but not the ligaments and cartilage in the joints. And I'd recommend Tendon Mender Joint Performance and Mountain Mid Velvet. In terms of absorbing your protein, Gastrozyme, 2 capsules before meals and snacks. And the proteins, you want a complete protein. All of our proteins are rice pea protein, Vega Pro, which are vegetarian source, and they're better in terms of quality and absorption than the whey protein. So
Next, Bill.
That's the key. Is you can take the digestive enzymes along with that, and you want to increase growth hormone, and you'll get much better effects.
Is Anonymous your favorite? Anonymous.
Oh, yes.
What's the youngest that can take the Nutridyne? I have a 2-year-old and an 8-year-old, and how much should they take?
You can take it when you're a fetus. So for a 2-year-old, you'd probably be taking like 1 or 2 drops, 2 to 3 times a day, twice a day at least, 2 drops. And for an 8-year-old, you'd probably be taking half an adult dosage, which would be around adult dosage, if you're worried about radiation effects, probably around 6 to 8 drops twice a day.
Okay.
Because you're going to drop radioiodine 131, it's still coming from Fukushima. You're trying to protect the mitochondria and rescue them, which is non-radioiodine effects.
Michael, in an email, hello, my dad had cataract surgery in both eyes about 1 year ago. In the beginning, everything was fine, and now his vision is not as good.
That's because they don't deal with the back of the eye, the retina. So you want to take things like Neurogen, Nutritrala, Vision Max, Can-C eye drops, Cell Detox Glutathione, Nutrifos, and Omega Supreme Krill to rebuild the retina, and you use Lumen Photon setting number 7, setting number 3, and Nico settings to Lumen Photon to regenerate the eyes. And it's proven even in animals where they give toxins, that Lumen will actually prevent blindness from even toxins that are known to cause 100% blindness. So.
Cool. Well, thank you, Bill, for another wonderful firing line out of here.
Still in the batter cage here for hour 2 and 3.
God bless you. Have a wonderful weekend. Thanks for listening, and we'll see you next week.
And by the way, hour 2 and 3 is open lines, but it's topical. Just tell the board op, who's Ben today on Fridays. And the number to call, 800-259-5791, 800-259-5791.